So this is the continuation of brushing methods. That is the next method is the Stillman's method. Here the bristle ends are being placed at a 45-degree angle with the bristles being placed partly on the gingiva and partly on the cervical portion of the teeth. And pressure is being applied laterally against the gingival margin to produce a perceptible plunge. And brush is being moved in a coronal direction along the attached gingiva, the gingival margin to that of the gingival surface. And the advantage of this method is it can be used in areas with progressive gingival recession in order to reduce the abrasive tissue destruction. So we can indicate this Stillman's method in cases of patients having gingival recession. And also this modified Stillman's method can be incorporated in patients after plaque surgery, because there, in case of patients after plaque surgery, there is a chances of recession formation. So the technique used in case of patients undergoing plaque surgery is Stillman's method. The next method is Starter's method. Here the brush is placed on the tooth with bristles pointing towards the crown at a 45-degree angle. This is how brush is being placed. The sides of the bristles are flexed against the gingiva and back and forth vibratory motion is being used to massage the gingiva. The next method is Rawls method or Cohn's method. It can be used in cases of children and it is easy to learn. And disadvantage is it's not effective to remove the plaque from the cervical area. So the brushes are being placed apically, bristles are being placed apically and swept in an occlusal direction with rolling motion. And the different effects of improper brushing can result in toothbrush trauma, gingival alteration, and can also result in abrasion of teeth. Then coming to the next mechanical aid, that is interdental cleaning aids. Interdental cleaning aids are used as an adjunctive devices which is used to remove the plaque from the interproximal tooth surfaces. The most commonly used interdental aid is the dental floss, which can be used in cases of interproximal surfaces in case of type 1 gingival embryo. It is used to remove the plaque from the interproximal surfaces with type 1 gingival embrasures, and different types of dental floss are available, multi-twisted or multi-filament. It can be either twisted or non-twisted, bonded or non-bonded, thick and thin, and waxed or unwaxed. And the functions of dental plaque is, the major function of this dental plaque is dental floss is in order to remove the adherent plaque and food debris from the interproximal embrasure and under the pontics of fixed partial denture. Then polishing of the tooth surfaces during the removal of plaque and debris. It helps in stimulating and massaging the interdental papilla, helps in locating the following like subgingival calculus or hanging margins of restoration, proximal caries lesions, and also improves oral hygiene and reduces gingival bleeding. There are two types of methods for using this floss. First one is about 45 cm long floss is being taken and is about 10 cm from each end is being wound around the middle finger of the each friend. In this aspect, both the hands, the last three fingers are folded and closed and both the hands are moved apart. In this way, about 5 cm long floss is held between the index fingers of both the hands. This figure shows how to adapt this floss. And the next method is circle or loop method. Here in this method, a loop or circle of the floss is made from about 45 cm long piece and both ends are being tied together with 3 knots, and all the fingers except the thumbs of the hand are being placed within the loop, and the floss is held by both the fingers having about 2.5 centimeter flaws between the fingers of the both hands, and is used mainly for the handicapped and mentally retarded patients. So a circle or a loop is been formed by using the flaws, and the flaws is been held and the flaws is been knotted, and about 2.5 centimeter long flaws is been moved up and down in between the tooth, and it is mainly indicated in patients who are handicapped or in case of mentally retarded patients. Then the next method is, so the flaws is over. So now coming to the next method, that is interdental brushes. Can be used in these interdental brushes can be introduced in case of type 2 gingival embrasures, and their design is similar to that of a bottle brush, which may be mounted onto specifically designed handles to make it used in posterior areas of mouth more comfortable. They may also be used to clean the percussion areas and root concavities. Then coming to powered interdental brushes. This device is more efficient than other interdental aids in removing plaque and reducing inflammation. Besides, it requires less dexterity and makes the access to gingival areas easier. Then the last type of interdental brush, that is unitufted brush. They are basically employed in type 3 gingival embrasures. So in case of type 1, we are using dental floss, type 2 interdental brushes, and in case of type 3 unitufted brushes. Besides plaque removal, these brushes may be used to carry antimicrobial agents like chlorhexidine into that of the interproximal area. So this is a picture showing different types of embrasure. In case of type 1, we are using dental floss, type 2 we are using interdental brushes, and in case of type 3 we are using unitufted brushes. Then coming to certain irrigation devices like water pick. Irrigation devices have been found to be valuable supplement for mechanical plaque control measures. It is mainly beneficial in the removal of unattached plaque and debris. They are mainly composed of a built-in pump and a reservoir. These devices may also be used to deliver antimicrobial agents like chlorhexidine subgingivally. Next, coming to the next interdental aid, that is the dentifrice. According to ADA, it has been defined as a substance which has been used with a toothbrush for the purpose of cleaning the accessible surfaces of the teeth. The composition of dentifrice, which includes abrasives, water, humectants, foaming agents, binding agents, flavoring agents, sweetening agents, therapeutic agents, and preservatives. The abrasives mainly used are calcium carbonate and calcium phosphate. Sometimes aluminum oxides are also being used. Then humectants, they are added to maintain the moisture. Most commonly humectants are sorbitol, mannitol or propylene glycol. And foaming agents like sodium lauryl sulfate and sodium N-lauryl succinate are being mostly used. And regarding the conclusion, plaque is formed so rapidly and its removal by the patient is so difficult that complete freedom from plaque over the extended period of time is an unrealistic goal. And complete prevention of plaque formation is not possible by any other conventional methods and not practical by current chemical means also. Instead, the goal of clinical plaque control at present is periodic mechanical or chemical plaque removal at intervals placed closely enough together to prevent the recurrent plaque formation. So in case of mechanical plaque control, we have discussed regarding the brushes, manual brushes, modified means manual brushes, electric brushes or power toothbrushes, then sonic brushes, iron toothbrushes. Then regarding the interdental aids like dental floss, then irrigation devices. Then regarding the dental brushes, unified tuft brushes, and also regarding the dentifrices. These all comes in mechanical plaque control. And also the major important things are different types of brushing techniques. So I think it's clear. Thank you all.